everyone who's tuning into this information session for type 1 diabetes at the Lee Health Endocrinology Clinic. My name is Jessica Quigley, and I'm the diabetes educator here at the Endocrinology Clinic, where some of your providers, Dr. Renato Concepcion, Dr. Hitham Ajluni, Dr. Patricia Sarah, and advanced practice nurse Janice King, practice and see patients. So, I'm going to get started today and we're going to be talking about alcohol and diabetes. I'm just going to share my screen so that I can show you the presentation that I put together. And for those of you who are watching this for the first time, we actually presented this live on June 2nd, and it was a really great presentation, very informative. So, I wanted to make it available for those who might have not been able to attend. So hopefully you can see the presentation. And again, it's titled Mixing Alcohol with Diabetes. And let's get started. So pour up a glass of water and we're going to review the following. We're going to talk about what is alcohol. We're going to talk about the side effects of alcohol, some good, some bad. We're going to talk about alcohol and social life, more specifically the peer pressure that might be involved when it comes to alcohol consumption. We're going to focus in on alcohol and calories, and we're also going to talk about the safe consumption guidelines when it comes to alcohol intake. So, alcohol, which is known as ethanol or ethyl alcohol, is actually formed when yeast ferments, which is fermentation is when something breaks down without the presence of oxygen. So when yeast ferments the sugars in different foods, we get a byproduct, which is alcohol. So for example, alcohol may come from grapes that are used to make wine. Um, Beer, which is usually made from the sugar that's in malted barley, which is a grain, and barley is actually a healthy grain, a complex carbohydrate. Cider is usually from the sugar that's found in apples, and again, apples being a fruit, lots of good nutrition in there, fiber. Vodka from the sugar in potato and beets, and tequila from agave, which is a plant, and that also is a sugar. So, just to kind of make that correlation that alcohol actually comes from foods that contain sugar, which is why alcohol provides calories. Now, how many calories does alcohol provide? We're going to talk about that a little bit later, but I want to kind of get into what the effects are of alcohol consumption first. So, we know that alcohol can help us relax, it can make us feel good. A lot of times, it can kind of give us that little bit of extra confidence. So people drink alcohol normally in social settings, and those are the type of effects that alcohol has on the body. But we forget that alcohol can really significantly impair our judgment. So it's never good to drink alcohol and do anything that requires focus or attention. And the other thing that we forget about is that alcohol can lead to unhealthy weight gain. So, a lot of people may come to me as a dietitian and diabetes educator for help with weight loss and get frustrated sometimes because they're not able to lose weight, but they forget that the alcohol they're drinking could be that extra bit of calories that they're getting in their diet that's prohibiting them from losing weight. And like I said, we'll talk more about the calories and alcohol in just a minute. On the flip side, alcohol can actually lead to malnourishment. So a lot of times, alcohol can cause the malabsorption of important vitamins and minerals in the body, and the body's not able to absorb. Therefore, malnourishment results. And a lot of times, you may find that people with alcoholism actually tend to be underweight. So that's not the end of the list here. Let's keep going. So alcohol, it can increase our blood pressure, and you should be really careful if you already have high blood pressure or are on any hypertensive medication. Alcohol is normally not a good mix. It can increase triglycerides. Triglycerides are basically blood fat. So triglycerides are formed when sugar and fat join together in the bloodstream and float around. Now, everyone has some triglycerides, but if you think about alcohol increasing, um, the fat and glucose in our bloodstream, we're going to get more of those triglycerides forming. Alcohol can damage nerves to our sexual organs. It can damage nerves to the brain. It can contribute to inflammation of the pancreas and liver. One condition maybe people are aware of is fatty liver disease. So, again, that's inflammation and actually scarring of the liver. It can dehydrate the body. So when we drink alcohol, we're not hydrating, even though we're drinking a liquid, we're actually causing some dehydration. So that is also an important note for people with high blood sugar levels or BGLs because they don't want to become dehydrated. Dehydration will actually cause those blood glucose levels to become worse. If you have any type of eye condition like retinopathy, the alcohol is not a good mix. It can actually worsen those eye conditions or eye disease. And I'm sure we all know that alcohol can lead to addiction, which is why, we have such groups like Alcoholics Anonymous, alcohol quit support groups, and so on, because it can be highly addictive, especially those who have a family history. And last but not least, alcohol can lead to injury. So again, when we're relaxed and we're not really focused and it's impairing our judgment, a lot of times we can get injured. So make sure that you're not operating anything that requires attention, like a vehicle, a motorcycle, even a bicycle for that matter. You're just going to put yourself at increased risk for injury. Okay, so, with all those things being said, why do we drink? People drink alcohol for many different reasons, but most of the time, alcohol is consumed in social settings, which is why I kind of show that video. People just getting together out on the patio, having a glass of wine. So, those are typical situations, and especially in Florida, the weather's nice all year round, so people tend to do these type of socialization events pretty frequently. Now, there are times where people may feel pressured to drink alcohol, such as maybe a work event or a networking event where alcohol is being offered. You may feel pressured to drink. You may actually be asked, why are you not drinking when you don't have an alcoholic beverage in your hand? So these are the type of situations that can get people into trouble, and that's where that peer pressure comes in. But for the most part, alcohol is something that people do drink because they enjoy to drink. It's part of activities and events where you're not at work, you're relaxing on the weekends and the evenings and those type of things, or out with friends. So there's nothing wrong with drinking alcohol, but we want to make sure we know what the safe limits are. And if we have diabetes, we want to make sure that we're aware of the risks associated with drinking alcohol with type 1 diabetes and type 2. So we're going to get into that in just a second. But like I promised you, we're really going to dive into the calories and alcohol because, again, as a dietitian, that's one of the most common questions I get is how can I lose weight? So I do want to touch base on the fact that alcohol does provide what we call empty calories. So empty calories being there's no nutrition provided when you consume that energy. It's just energy. And as we may know, if we don't utilize that energy, it gets stored into body fat, which is what we don't want to put on. Most people want to lose body fat. So I just showed a little video of somebody explaining a diet plan, and as you can see there, hopefully those beverages in the video are not alcoholic beverages because they are supersized in portion. Hopefully this is water. So alcohol provides exactly 7 calories per gram. Now, what does that mean? Well, it's 7 calories per gram for alcohol, and if you think about carbohydrate or protein, those macronutrients only provide 4 calories per gram. So alcohol is pretty high. Fat provides 9 calories per gram, so fat actually is more energy dense than alcohol. But as you can see, alcohol's kind of in the same range. And like I said, they're empty calories because there's no nutritional benefits. So to make it simple, an average or standard drink provides a minimum of 70 calories of energy, but most drinks contain more than 70 calories due to the large portions and the additional ingredients that people add. So think about when we consume alcohol. Often we're also consuming things like sodas, juices. Some people add syrups like grenadine, or some people add sugar, and put that in with supersized portions, and it leads to loaded calorie consumption. So hence the video of the pina colada on the side here, looking all nice with the little sugared rim and pineapple slice, and who knows what else is in there in terms of sugar. But you can see how it can quickly add up. The other thing you want to note on is that also liquid tends to empty out of the gut quickly. So Not like food, right? Food empties the gut slowly, liquid empties the gut quickly. And that means that we can easily drink large portions of high caloric beverages like a big pina colada, and we wouldn't feel full as like if we were to eat the same intake of calories from food. Okay, and that's because that liquid empties out of our stomach really fast. So be careful of those things. The next slide just gives you a little idea as to what the calories on an alcoholic beverage tend to look like when it comes to food. So if you see here, a glass of beer is equivalent to like a Dunkin' Donut, okay, but 170 calories. So if you have two beers with your dinner, that's like you just ate two donuts. A large glass of white wine, kind of like eating an ice cream bar, 228 calories. Most people might have one or two glasses of wine. So again, that's like one or two ice cream bars. A gin and tonic, so 213 calories, kind of equivalent to a Dairy Milk caramel bar. And a glass of champagne, sort of equivalent to eating a small bag of chips, 89 calories. And again, you just want to be aware of these empty calories, right? I'm not trying to turn anyone from alcohol. I'm just trying to make you aware. Okay, so what is a standard drink? So I have this visual here of what a standard drink looks like, and the measurement would be for beer about 12 ounces. For malt liquor, it would be about 8 ounces or 1 cup. And for wine, it's actually 5 ounces. And most people definitely have more than 5 ounces of wine when they pour up a glass of wine or go out to eat and have a glass of wine. Probably the only place you'd get the real standard drink portion size would be one of those really fancy restaurants where they actually pour out 5 ounces. And you also want to be aware of like spirit. So a shot glass of like vodka or tequila or rum, any of those type of beverages, about 40% alcohol, it's 1.5 ounces would be considered one standard drink. So what does that mean? So how many standard drinks can you have per day? So for a male, it should not be more than 2 to 3 or less than 15 per week. And for a female, it should not be more than 1 to 2 per day or less than 10 per week. So when you think about a glass of wine is 5 ounces and most people would have about 10 ounces in one glass, that is two drinks. So if you have two 10-ounce glasses of wine, you're actually drinking four drinks in one sitting. So just something to be aware of again. Um, the information you're receiving today is to help guide you in making better choices in the future. Okay. So now that we've talked about the calories in alcohol, we've talked about what a standard drink is, and we've talked about how many standard drinks a male and female ideally should keep to as a limit per day. We're going to talk now about what's happening in the body when we drink alcohol. So we're going to talk about the functions of the liver, alcohol and glycogen, alcohol and the detoxification process that happens in the body, as well as hypoglycemia. So, the liver is the organ that's directly involved when we consume alcohol. And just some facts about the liver: it weighs approximately 3 pounds in the average adult. It is the second largest organ in the body. And just so you know, the first is the skin. So, the liver comes second. That means it's larger than our brain, it's larger than our heart. Right? It's larger than our kidneys. So it's a big organ and it does a lot. And that visual you see there is exactly representing where the liver sits. So it's in the upper right quadrant of the abdominal cavity, just below the diaphragm. And it performs a lot of essential functions in the body, over 200 to be exact. Another interesting thing about the liver, and this relates to alcohol as well, is that it regenerates itself. So if you do have some high alcohol intake that happened in the past, if you kind of make healthy changes moving forward, your liver cells will actually regenerate itself. So that's kind of a neat thing. But we have to treat our liver with respect. And the reason why we need to do that is because the liver has essential functions, and I've highlighted two that we're going to go into more detail today. That is number 5, storage of glycogen, and number 7, blood detoxification and purification. So we're going to talk more about those two because they're very important in the body and they also relate to diabetes. So let's talk about glycogen. Glycogen, what is it? It is the storage of glucose in the liver. So every time we eat, especially when we eat foods that contain carbs, our body is amazing. It'll store a little bit of glucose in the liver. So that way, when we're doing activities where we need extra energy, such as exercise or just basic day to day life functions, we don't always have to be continuously eating. Our liver is going to help keep our blood sugar stable. It's going to release glucose when our blood sugars start to drop low. So think of it like this: it balances the blood glucose levels like a teeter totter. So when it's low, when the blood sugar levels are low, that liver is going to release a little bit of glucose into our body. And of course, when our blood sugars are high, our liver normally doesn't release glucose. However, there are some instances, such as type 2 diabetes and type 1, where our liver might actually release more glucose into the bloodstream, even though our glucose levels are high. But we won't get into that today. That will be for another presentation. Okay, so as long as you understand that the glucose stores glucose, or sorry, as long as you understand that the liver stores glucose in the form of glycogen and it's released when blood sugars drop low. The other important function that the liver does is detoxify. So our liver is constantly filtering our blood. It's basically the best detox you could ever have, the best spa, because the liver is doing all that detoxification for us. And sometimes we forget. So every bit of blood that passes through our stomach and intestine has to pass through the liver. So that means that when we drink alcohol, the alcohol in the blood is getting passed through the liver, and that's a good thing because then alcohol is recognized by the liver as a toxin, and the body or the liver can filter out that toxin. So kind of like if you were to think about um, water and molecules going through different screens, our liver is kind of filtering out those toxins. So it helps keep our body in homeostasis, which is the chemical balance in a living organism. Okay. All right. So if you think about it, if you're drinking alcohol and your liver is under the detoxification process, it doesn't actually release glucose. So it can't do both of those functions well at the same time. So what happens is people end up, especially with diabetes, with hypoglycemia, which is low blood sugar or glucose under 70 milligrams per deciliter or 5 millimoles per liter. Now, hypoglycemia we don't want to happen because it can be quite dangerous. And that's one of the reasons why we have to be careful when we drink and we have alcohol in our blood and we have diabetes. So if we're on diabetes medications such as insulin, hypoglycemia is definitely going to be more prone to happen with the mix of alcohol. Okay. So, just so you know, alcohol intake can result in hypoglycemia up to 24 hours after alcohol is consumed, which is important to note because let's say you go on a Friday night and you have a couple of drinks with your friends, your blood sugars are great, they're like 106, 110, they're really great. Um, Later on that evening, you go to bed, and probably around 3 in the morning, your Dexcom sensor, let's say, goes off. Those of you who have a CGM understand the low alerts, right? So your low alert goes off on your sensor and it's at 60, but you might not even hear it because you might be asleep. So this is the kind of thing that can happen and can be quite dangerous because if you have a low blood sugar and your liver is not able to release out some extra glucose, you can drop low really fast. And you can also have a dangerous situation. And we're going to talk about that because there's certain things that do not work when you have a low blood sugar, when you have alcohol in the body, and that would be glucagon. And we're going to talk about that in a second. But basically, just to be aware that that low blood sugar can happen hours and hours after you drink. So be cautious. That's why it's important to keep monitoring your blood sugars when you consume alcohol and you have diabetes. Okay. And remember, the reason why, I want to just stress this again, the reason why that liver doesn't help out and release that sugar is because it's kind of busy. It's detoxifying our bodies of alcohol, right? And another thing to note on is that when you do have a low blood sugar, you might notice that some of the symptoms that people feel, like excess hunger, fatigue, confusion, dizziness, shaky, and sweaty, those are very similar to the symptoms that somebody might experience when they've had too much to drink. So that's another little thing to keep in mind that sometimes you might not even notice someone's having a low blood sugar who is diabetic because the symptoms are so similar. So be aware of that as well. So, now that you understand what's going on there when it comes to the liver and alcohol, we can take a little sip and learn about the following: when you should avoid alcohol altogether, or when you should avoid it. We're going to talk about some tips to help you drink safely. Because again, this presentation is not to cause anyone to feel like they have to give up alcohol altogether, but we want you to drink safely. We're also going to review the treatment, the proper treatment for hypoglycemia, and we're going to talk a little bit about carbohydrate counting. Because as you know, alcohol has calories. So alcohol definitely has carbs if you think about some of the foods it comes from, the grapes and the potatoes and um, the apples. So are we going to count those carbs? So we're going to talk about that as well. So first of all, just to reinforce this, you should not drink alcohol if you are pregnant or trying to become pregnant, if you're breastfeeding, if you have a personal or family history of drinking problems, if you're planning to drive or engage in activities that require attention or skill, or if you're taking certain medications. You should not drink alcohol because it can make things worse if you have the following conditions: disease of the pancreas, such as pancreatitis, eye disease, such as retinopathy, high blood pressure. Even if your blood pressure is controlled, you want to be careful because those medications you're on might not mix well with alcohol. High triglycerides, liver problems like fatty liver disease, nerve damage like neuropathy, which is damage to the nerves to the hands and feet, or if you had a stroke in the past, which is a um, blockage of blood flow to the brain. So, if none of those things apply to you, or if some of those things you're not sure of, you can ask yourself the following three questions just to make sure you're drinking safely. So, you can ask yourself, is my diabetes under control? Yes or no? And really, diabetes could be under control if your A1C is less than 7%, or if you do use a continuous glucose monitor, your time in range should be at least 70%. Ask yourself, am I free from health problems that alcohol can make worse? So if you have some issues that we just talked about, like high blood pressure or retinopathy or neuropathy, which are common for people with diabetes, you might not want to drink alcohol because it can make those conditions worse. And the most important question here I would ask myself, because again, if you choose to drink, that's your choice, but do you know how to prevent and treat low blood sugar? Because that's going to be really important. So hopefully after the end of this presentation, you'll be able to answer yes to that third question. Now we're going to get into some tips on how you can drink safely. Stick to those standard drink limits per day. Remember 2 to 3 for a male, 1 to 2 for a female. And also just keep in mind that, when you are having to try and avoid those peer pressure type of situations, we're going to give you some tips around that as well. So, number one for how to drink safely is that making sure you're sticking to your limit is a good place to start. So, alcohol can be consumed safely if you consume it in moderation and within your limit. You may find that after you have an alcoholic beverage like a glass of wine, drinking a glass of water, could be still or sparkling water, in between those alcoholic beverages will help you to slow down your pace and stick to that limit. Okay? The other thing you can do is when you are drinking, make sure you sip your beverage. Drink slowly. Sip and savor your alcoholic beverage versus guzzle. And that's kind of the same thing for food, right? We want to eat our food slowly and enjoy the taste so we don't overeat. Same thing with drinking. We want to sip our beverage, enjoy the taste, enjoy the moment, but we want to prevent ourselves from over consuming that alcohol. All right. Number three, drink water. So, as I mentioned, alcohol causes dehydration. So, you want to make sure that you do drink lots of water, which is another reason why it's nice to have a little glass of water in between your drinks to keep yourself hydrated. It water won't only help you slow your pace down, but it will help with the glucose stability because if you're hydrated, remember your blood sugar levels are going to be more stable. They're not prone to go up like they are when you're dehydrated. And the other little tip that I can give you is to keep water next to you at night, so that when you are back home from wherever you've been, you're able to have quick and easy access to water. Because a lot of times, if you're tired, you might sleep through that dehydration or that dry mouth. So, keeping water next to you is really important. Also, making sure you wake up the next morning and drink water. Another thing you can do, and this is a nice one for if you feel pressure to drink in social settings, is to use a wine glass or one of those glasses that people normally hold water in, like a red cup, for example, and put your water in there. That way, if you feel pressured to drink, you're drawing less attention to yourself when you have a water bottle. So unfortunately, a lot of times, if you're out and you're not drinking an alcoholic beverage, you might have been asked, "Oh, can I get you a drink?" Or "How come you're not drinking?" These are common questions, right? Because you're kind of out of the norm, unfortunately. So having that glass with water can kind of prevent some of those awkward questions, kind of prevent some people from having to maybe feel like they have to explain themselves. Even though you shouldn't feel like that, I know it does happen. So that's the whole tip there on placing water in the same glass as what someone would place alcohol in. Monitoring blood sugar. So make sure you test your blood sugar before, during, and after. Now, I know sometimes it's hard to whip out your glucometer and start testing your blood sugar, especially in social settings. So if you have a CGM or a continuous glucose monitor, that's a great device that can help you keep an eye on things. It's giving you an idea as to where your blood sugar is predicted to be. Most CGMs now have alarms, so you can actually set your a low alert to a higher level, like an 80. That way you can take action before you actually get to a 70 or below. So CGMs are definitely a great piece of technology when it comes to monitoring blood sugars. And if you don't already have a CGM, definitely let myself or my coworker and the RN care coordinator here, Donna Hayward, know, because we can help you get on one of those devices. So as long as you're on multiple daily injections of insulin and you're testing your blood sugar at least um, 4 times a day, then you should be eligible. Okay. Number 6, regular meals. So just like a normal day, when you drink alcohol, you really want to make sure you have those regular meals. You're not skipping meals. You make sure you have a balance of carbohydrates. Normally, a good kind of range would be around 30 grams of carbohydrates. So if you think about carb counting, that's like 2 slices of bread or half a cup of rice or half a cup of pasta. Or it could be a piece of fruit with half a slice of bread or half an English muffin. So we won't get into a lot of carb counting today, but 30 grams is kind of what you want to aim for per meal. And that should help keep your blood sugars kind of balanced throughout the day, but also give your body a little bit of glucose to be stored. Okay. It's also a good idea on top of regular meals that after a night of drinking or a day of drinking, whatever you're doing there, that you do have some sort of snack before you go to bed. And that also helps keep the blood sugar stable. So we recommend having a source of carbohydrate. So 15 grams of carbohydrate with a little bit of protein. So something like peanut butter, almond butter, cheese, those type of things. Hypoglycemia treatment is tip number 7. So again, make sure that you know how to treat a low blood sugar, and we want to make sure that you have the right fuel as well. And I always tell people, remember the 15 rule. So let's go over the 15 rule. So that is consume 15 grams of fast-acting carbohydrate as soon as you get that low alert on your sensor or you feel the symptoms of a low blood sugar and you test it. If you're under 70 or you have the symptoms, even if you're above 70, you should be treating it with 15 grams of fast-acting carbohydrate. And that's because we want the blood sugar to rise up fast. We don't want it to digest slow. So foods that we typically tend to tell people to stay away from when they have diabetes, we actually want you to consume those because we want that fast rise in your blood sugar. So those things would be like a half a cup of juice, a half a cup of regular soda, not diet, 4 dextrose tabs or glucose tabs, a tablespoon of sugar, whether it's brown, white, honey. That all gives you 15 grams of fast acting sugar. Once you treat your body with 15 grams of fast acting sugar, you want to give yourself some time. So wait another 15 minutes, recheck your blood sugar. And if your blood sugar is above 70, you want to have a snack. So, like crackers and cheese or peanut butter on a slice of bread. So, again, 15 grams of carb with a little bit of protein. But if for some reason your sugar hasn't gone back above 70, we do recommend you treat it again with another 15 grams of fast acting carb. Wait a bit, make sure when it's above 70, you do have that carb and protein snack. That's how you properly treat a low blood sugar. And again, if you're out and you have your low alarm set to 80 and you're drinking alcohol and that low alarm goes off, definitely do those 2 steps. That way you're preventing yourself from going low because this is what the dangerous thing is when it comes to diabetes and alcohol. This is the most dangerous thing. The low blood sugar can occur, but the glucagon, that glucagon emergency kit that you might have at home that you've never needed to use, but you know you need to use it in emergency situations, well, guess what? It doesn't work when your body has alcohol. So even that glucagon, which is a hormone that causes the liver to release sugar, even that glucagon can't get the liver to release sugar because the liver is so focused on detoxifying the body of alcohol. That's how much emphasis the liver has on detoxifying your body. So glucagon won't even work. So this is very important to note. So again, how do you want to prevent that situation from happening where you would even need to use glucagon? Make sure you monitor your blood sugars, right? Eat those carbohydrate containing foods during the day and have those snacks. Even have a carbohydrate containing snack with you, right? Wear a diabetes identification medical alert bracelet. You don't want to think that you're out by yourself and you have a few drinks and you go low and somebody just thinks you're drunk. You want to make sure that somebody knows that you do have diabetes and to call 911 because, again, glucagon is not going to work. So you're going to need emergency attention if you pass out when you have diabetes and are under the influence of alcohol. And always remember, right? It's because your body is in detox mode. So your body always prioritizes things. So it's going to be prioritizing that detox. All right, number 9. We're almost there with the end of these tips now. So we want you to know that there are many different types of alcohol and mixed drinks in this world. So just like food, if possible, make your own from home. That way you can control the amount of alcohol that's added in, and you can also control the mix that's used if there is some type of mix. If that's not possible, if you're not actually making your own drink, you can choose alcohol that tends to be lower in carbs, like low carb or light beers, dry wines like red or white, or you can use mixers like diet sodas or tonic water, seltzers, those type of things to reduce the sugar content of mixed drinks. And also, if you're going to a social event where you can bring your own beverages, that's always a good idea as well because some people will bring their own drinks that don't even have alcohol. So those are other little tips that you can do to drink and choose drinks wisely. And number 10, good news is you don't have to carbohydrate count with when it comes to alcohol. So we always want you to carbohydrate count foods, but when it comes to alcohol, if there's any carbohydrates, you actually want to just ignore it. We do not want people to be entering in carbs of alcohol into their pumps and bolusing or injecting insulin because, again, there's such a high risk for going low that you don't want to increase that risk by now having added insulin in your system. So normally when I explain it like that, it makes sense and people are quite happy not to carb count in these type of situations. All right, so just so you know, we do have a chart here that talks about different types of beverages and the serving size and how many carbs and calories are in these beverages. This is kind of just an FYI because, again, you're not actually going to be counting these carbs when you're bolusing or giving yourself insulin. However, it's good to know because you can make a choice that of a beverage that has a lower carb content or maybe a lower calorie content. That way, you're still trying to choose the best drinks for you. And there are resources that are available on the diabetes, um, the website for this. I'm trying to think of the name of it, but I will send that out in an email with along with this video. But there's also another guide from the Canadian Diabetes Association that I'll send. It's called Alcohol and Diabetes, and that also has a chart with different alcoholic beverages, the calories and carbohydrate content. Just because I guess that most people know this, that if you buy wine or buy coolers or some type of like spirit, you'll never see a nutrition label, right, on the alcohol, because that's not a FDA rule. So if you pick up any food product, there's always got to be nutrition facts listed, a nutrition panel. But when it comes to alcohol, that's not actually a rule. So this is why we actually need to have those little charts handy. Okay. So that concludes the presentation on alcohol and diabetes. And again, I always like to tell people this is not about perfection. We don't want you to have to feel like you can never have a drink again, because alcohol is part of many social events, many holidays, many celebrations. So it's totally okay. But at least now you know what standard drinks are, how many is considered safe per day, what you need to do if you are drinking and you have alcohol. Keeping that blood sugar checked, keeping those snacks handy, even making sure that somebody around you knows that you have diabetes because you can even have a sensor like a CGM, such as Dexcom or the Freestyle Libre. And one of your family members or friends can also have the app on their phone and help keep an eye on things. So help keep you from going low. So those are other little features that are really cool when it comes to CGM technology. But again, just letting somebody know that you have diabetes and what to look out for is important. So, cheers to a great presentation. I hope you've enjoyed. And if you have any questions, feel free to email me. I will send my email and number out with this video and the resources. That way, you always feel supported here at the LPG Endocrinology Clinic. And I hope that we see you again for future presentations that focus on type 1 diabetes and various topics. And last but not least, because alcohol addiction is such a um, highly addictive substance. We do want to make sure that people are aware there is an alcohol addiction hotline. It's 1-855-865-7794. This is a great hotline for people who are struggling or in times of crisis when it comes to alcohol. So, again, we're here to support you in your diabetes and other health issues as well. And thank you so much for your undivided attention. And I hope that you have learned something new today and that you can help others as well. Thank you.